care for the conscious client.
And what position should the client be in to prevent aspiration?
The client can be standing or sitting upright or in a high Fowler's position.
What equipment should be used during oral hygiene?
We have toothpaste, toothbrush, floss pick, a cup of water, and mouthwash.
And the extra items that you may need to use is a kidney basin if you're not at a sink, and a jug if you're not at a sink to hold extra water. Kidney basin is used for the client to spit into, or you can use the sink if the client is able to get to a bathroom with the sink. And what order should we be doing oral hygiene? What's first?
So we should be using the toothpaste with the toothbrush and placing a size of a pea, so a pea size amount on the bristles, and urging your client to brush for 2 minutes. Then we're rinsing, and then we're going to do the floss pick, rinsing, and then mouthwash for 30 seconds, and then spitting, and that should be the final act of the oral hygiene without rinsing after the mouthwash.
Perfect. And how often should the PSW be offering oral hygiene to clients?
So the PSW should be doing it twice a day in the AM and the HS.
Okay, and what does HS stand for? Hour of sleep or bedtime.
Okay.
And after the client has finished, the last step, or one of the last steps, is to make sure that you assess the oral cavity. So you ask the client to open their mouth, look up and around to see if there's any bleeding, redness, or any other abnormality.
This is oral care for a client with dentures.
And what position should the client be placed in to prevent aspiration?
The client should be either standing, sitting, or in a high Fowler's position.
Great. What kind of equipment should be used for denture care?
We have the dentures. This is the upper denture, the lower denture. This is called a partial denture, where the client has one or a few teeth. Not all are missing. We have a denture brush, which has usually 2 sides of bristles, one larger area and one with very pointed bristles. We have a denture cup. We have gauze in case the PSW needs to assist with the removal of the dentures. And there's denture cleaner, and you would only use that based on the directions in the care plan. Then you also have the setup for oral hygiene care, because the client would still need to be brushing their gums and their cheeks, their tongues, and the roof of their mouths, even if they're missing all of their teeth.
And once the dentures are out of the mouth, is there anything that the PSW should do?
So the PSW should assess the oral cavity for any diseases or anything that looks abnormal, and we'll review that in the PowerPoint video. The PSW should also be looking at the dentures and making sure that the metal pieces on a partial denture are intact and there's nothing broken, nothing is chipped, none of the teeth are chipped or broken, and everything looks nice and intact on the inside and the outside.
And if you're a PSW, what would you need to wear to protect yourself?
So the PSW would always be wearing gloves, always. And if a PSW needs to assist with the removal of the denture, you would use a piece of gauze folded like this, and if I am the client and I needed help, the PSW would take it like this for the top, and you can do that.
Yeah. Right, so you want to wiggle it to try to break the seal. Sometimes they use an adhesive, so you'd have to gently break the seal, remove the upper denture first, and then remove the lower denture with gauze. Right, so we want to remove this one. You may have to turn it sometimes sideways to help assist it out of the mouth.
And be careful because they are very slippery.
And very easy to break. So now that the dentures are out of the mouth, let's look at what it would look like to clean. So we're at the sink. Remember, the client doesn't need gloves, but the PSW would be wearing gloves. We've lined the sink with the towel, and we're going to fill the sink. Make sure that the water is not too hot because that will warp the dentures. And you want to fill the sink to about 1/4 to half full. And the purpose of that, when you're cleaning dentures, they get very slippery and sometimes they'll fall. So we want the water to be able to slow down the dentures, and the towel will help prevent it from breaking when it hits the bottom, if it hits the bottom. So if we have our dentures, we would use our denture brush to clean and clean off any excess material or adhesive. We would place them into our denture cup. So we want to place our upper dentures and our lower dentures. You usually fill this with water, right? And then sometimes you would use the cleaner to also place in here and keep it there overnight.
And make sure it's always labeled as well.
With the client's name. Yeah. So remember that denture care is done at HS. It's done at bedtime. And in the morning, the dentures are already clean. So in the morning, the dentures are inserted into the client's mouth. This is oral care for the unconscious client. So here we have our supplies. So we need a kidney basin so that any extra fluids coming out of the client's mouth can fall into the kidney basin. You'll need a pair of gloves. You'll need some detergent or whatever they're going to use to clean the mouth. Right now I just am using water. This is a special tool instead of a toothbrush. This is called a mouth swab, and it's used for care on an unconscious client instead of a toothbrush to clean the oral cavity. And then this is a padded tongue blade, and this is used to open the client's mouth instead of putting your fingers into the client's mouth. Just in case they bite down, you don't want them to bite down on your fingers, so they'll bite down on this. To make a padded tongue blade, you get a stick. You take a piece of gauze, which you would open from your clean package, and you want to wrap this around. Wrap it again, and then you use a piece of tape to tape it into position. All right, so that's how you make the padded tongue blade. Okay, and this you would use to open the client's mouth. So we have our unconscious client here, so I'm going to put on my gloves. And remember, the position, the safest position for the unconscious client is to place them in the lateral position so that they can be drainage and prevent aspiration. So we want to inform the client, hi, I'm Joanne, I'll be touching you, I'm your PSW. I'm just going to put you into the lateral position. Let your client know what you're doing. I'm going to put your arm in an L. I'll be bending your leg. Make sure you introduce yourself so they know who you are. And I'm going to roll you over towards me. so that any excess dripping is going to fall into the kidney basin. And gently pry open the client's mouth. Open slowly. For my client, open slowly. There we go. We're gonna pry it open with our tongue blade and keep it in there. But I don't wanna keep it in there. You're gonna take your mouth swab, put little bits of water. Don't put too much water, so we have little bits of water here. And you're going to put it into the client's mouth and clean all around. You're also looking and assessing the cavity for anything abnormal, bleeding, etc. So once we're done, we can gently close the client's mouth, remove our products, reposition our client, and continue with the next task. I'll just roll you back over.